there, my name's Kristen. I'm here to do an exam on you today.
Hi,
What is your name?
I'm Kelly.
Kelly, do you know where you are?
I'm at my house.
Good. And do you know what the date is today?
It is December 2nd.
And who is the president?
Barack Obama.
Good. So, Kelly, I'm going to start out by doing a neurological exam on you. We're going to test your cranial nerves to begin with.
Okay.
So, first of all, I'd like you to close your eyes and plug one nostril, and then tell me what you smell.
Peppermint.
Good. Go ahead and close your eyes again and plug the other nostril and tell me what you smell this time.
Lemon.
Perfect. And I noticed that before you came in, you had your Snellen test done, which is how we test cranial nerve number 2, and your vision was 20/20, so that's great. And I'm going to move on to testing cranial nerve number 3. So this is about your eyes. First of all, I'd like to ask you just to lift your eyelids. Good, and close your eyes. Good. And just follow my finger. Try not to move your head. Good, perfect. I'm going to check Perla, which is to see if your pupils react to light. So go ahead and just look over my shoulder, pick a spot on the wall. Good. Perfect. This time I'm just going to be watching the opposite eye to make sure that the pupil reacts appropriately. Perfect. Thank you. I'm also going to check your peripheral vision. So I'm going to come in from behind you. If you can turn just a little bit. Tell me how many fingers you see once they come into view.
2.
Perfect. Okay, go ahead and sit back. This time I'm actually going to use my light, and I'm going to watch for a red light reflex. Perfect. Great. And I'm just going to look inside your eye. This time I'm checking to make sure that you have good vessels and that there's no AV nicking, and looking for the optic disc. And I would also perform this exam on the other eye as well. And that's, actually I was testing cranial nerves 3, 4, and 6 by performing those exams. I am going to move on to test cranial nerves 5 and 7. And I'm going to start by asking you to just puff out your cheeks. Good. And go ahead and open and close your mouth. I'm just checking for TMJ there. Let me see you smile and frown. Perfect. And scrunch your forehead. Great. I'm going to check for cranial nerve. Well, actually, I'm just going to check the sensation in your face. So tell me, this will be what it feels like for soft, and this will be what it feels like for sharp.
Okay.
Go ahead and close your eyes. Tell me what you feel.
Soft. Sharp. Soft. Sharp.
And
Soft.
good. Okay, you can open your eyes. We're going to move on to testing cranial nerve 8, and this has to do with hearing. First of all, I'm actually going to ask you to plug one ear and then rapidly plug and unplug it while I whisper something.
Princess.
Good. Now go ahead and plug the other ear.
Spider-Man.
Perfect. Let me know if you hear anything.
Yes.
How about now?
Yes.
Perfect. Okay. This is called the Weber test. All you need to do is let me know if you can feel and hear vibration, and if you can, if it's equal on both sides.
It's equal on both sides.
Good. This next test is called the Rhine test, and let me know if you can hear it, and if so, for how long.
I can hear it.
And tell me when it stops.
Stop.
Now tell me if you can hear it, and let me know when it stops.
Stop.
Good. So this test proves that your air conduction is twice as much as your bone conduction, which is good. That's what we want. Next, I'm going to be testing cranial nerves 9, 10, and 12. We're going to start by, I just want to ask you to stick your tongue out and point it up towards your nose. Good. Go ahead and put your tongue back inside and press it out against the inside of each one of your cheeks. Perfect. Go ahead and open your mouth, stick out your tongue and say ah. I'm checking your gag reflex.
Gag.
Okay, she gagged. And I'm going to use my light to look inside. I'm watching to see, when you say ah, go ahead and say ah. I'm looking to make sure the soft palate rises, which it does, and that the throat and the pharynx look good, and they do. While I'm here, I'm also going to perform your mouth exam. I'm just looking to see, it looks like you have great dentition. Your tongue is a healthy pink color. I don't see any sign of discoloration or fissures, and your membranes are a nice pink color as well. I am just going to check your swallow reflex. So I'm going to hand you this cup of water and make sure you can swallow. Perfect. And I'm going to finish the cranial nerve exam by asking you, I'm going to check your cranial nerve 11. Go ahead and just shrug your shoulders. Perfect. And then press your face against the resistance of my hand. Perfect. Very good. So that completes the cranial nerves, but I'm still going to continue testing a few neurological things. Let me have you show rapid alternating movements of your hands. Perfect. And then finger to thumb through all of your fingers. Great. And I'm going to ask you to close your eyes. Oh, actually, first, keep your eyes open. You're going to touch the tip of your nose, and you're going to touch the tip of my finger. Okay, now I'm going to keep my finger here, and you're going to close your eyes, and you're going to keep going. Perfect. Great. Very good. I am going to check vibratory sensations while you're here. This is the same tuning fork. This time I'm going to apply it to your hand and your foot, and I want you to tell me when it starts and when it stops, okay?
Okay. Start.
Oh, and close your eyes during
Stop.
this test. I forgot to mention that. Very good. Okay, close your eyes again. And
Start.
Good.
Stop.
Okay, great. Now once again on your feet. Tell me when it starts.
Start. Stop.
Good. One more.
Start. Stop.
Great. I'm also just going to check for sharp and dull sensation real quick while we're doing this. It'll be the same thing as before on your face, except we're doing it on your hand this time. Close your eyes. Tell me if it's sharp or dull.
Dull.
Good. Now your other hand.
Sharp.
Good. And on your foot.
Do you need to take off my socks?
Yeah, I actually do
Okay.
need you to take your socks off.
Sorry about that.
Thank you. Okay.
Dull.
Good.
Sharp.
Very good. Okay, great. You can open your eyes. Okay. At this point, are you comfortable on the couch to be able to touch your heel to your shin? It's kind of difficult because the couch is low. Very good. You were able to do that on both feet. I'm going to ask you to stand up. And I'm going to perform the Romberg test on you. I just want you to close your eyes, keep your feet together, and your hands down to your side. I'm going to stand close to you, and we're just going to check your balance. Very good. If you need to, you can open your eyes, and you can use your arms for balance, but I'd like to see you stand on one foot. Great. Now on the other foot. Perfect. Okay, great. At this point, can I just have you walk normally towards the television? And when you walk back, walk on your tippy toes. Good. Now walk again on your heels only. And when you come back, walk with your heel to toe like you're on a tightrope. Very good. Okay, the last thing I'm going to have you do while you're still standing is check for scoliosis. We'll do a screening. Just put your hands together and bend forward at the waist. I'm just checking to make sure that your back is symmetrical, that your hip bones and that the hump of your back are even, and they are. And I'm checking the spine itself. I don't feel any curvatures or abnormalities. Do you have any pain or discomfort in your spine?
No.
Okay, good. I think everything looks really good there. You can go ahead and have a seat. So I am going to move on to just examining your skin. First of all, Your skin color looks great. It's nice and pink. I've noticed that you have great capillary refill in your hands, which determines skin color a lot of times. And same as in your feet, great capillary refill and great color of your feet. I don't notice any lesions or any moles, so I think everything looks fine.
Okay.
I'm going to just check your hair. It looks very healthy and beautiful. I don't see any abnormalities or any dry skin or sores on the scalp. Do you have anything that bothers you with your hair?
No.
Okay, great. While you're here, I'm going to check your lymphatic system. I just want to feel for any swollen lymph nodes. I don't feel anything so far. I don't feel anything swollen in her lymph system. So I think I'm just going to move on and do an exam on your throat, on your neck. Let me have you turn away from me. I'm going to feel your thyroid and make sure you don't have any nodules. Let me have you swallow. Good. Everything feels normal. Okay, great. Go ahead and sit back again. And this time I'm going to just check for your pulses, a carotid pulse and jugular, and I can feel both. I'm examining your trachea to make sure that it's not off-centered or pulled to one side or the other, which it's not. And I am going to use my stethoscope to listen for any bruits. I'll use the bell of my stethoscope. I don't hear any bruit there. I don't hear one here either. While I've got the bell of my stethoscope, I'm just going to listen to your heart sounds. I'm going to start with your aortic and your pulmonic and herbs, tricuspid, and mitral. Good. I'm also going to use the diaphragm and listen to your lungs from the front while we're right here. Go ahead and take a deep breath. And again. Perfect. And if you're okay to, let me have you just turn and I will listen to more breath sounds in the back. I'm going to listen to all 6 of your lung fields. When you're ready, take a deep breath. And again. Again. Great. And then your 7th lung field over here underneath the right armpit. Perfect. I'm also going to ask you to say a few things while I listen with my stethoscope. I'm going to start by asking you to say 99.
99.
Again.
99.
And I would do this in all 7 lung fields. This time I want you to whisper 1, 2, 3. And again. Great. I don't hear anything, so that's good. And this time I want you to say the letter E.
E.
And again.
E.
And I would continue to do that in all of your lung fields as well. Now without the stethoscope, this time I'm going to check for tactile fremitus. I'd like you to just say 99.
99.
And repeat it again.
99.
And one more time.
99.
Perfect. Thank you very much. Okay, Kelly, I think I'm going to ask you to lay down on your side, your left side with your head on the pillow facing that way. I'm going to check your heart sounds again.
Okay.
This time I'm going to use the diaphragm of my stethoscope. And I'm just checking for PMI. I don't feel any thrill. Everything sounds good. So I'll have you roll onto your back so that you're facing up. While you're here, I'm going to listen to your bowel sounds. I'm going to check all 4 quadrants. We want to make sure that we hear active bowel sounds. And I do. Now I'm going to use the bell of my stethoscope and I'm going to check your aorta, listening for bruits. I don't hear anything. And your femoral arteries. I'm listening for a sound of bruits, which I don't hear. Good. While you're here, is it okay if I just inspect your abdomen for a moment? Everything looks great. I don't see any scarring or any discolorations. Do you have any pain or tenderness in your abdomen?
No.
Okay, so I'm going to start by actually checking to locate your spleen and your liver.
Okay.
I'm going to look for your spleen first. Good. Now, I hate to make you do this, but I need to have you switch sides so that you bring your head down to the other end of the couch. And this time we're checking for your liver. Good. While you're here, I'm just going to lightly palpate your abdomen and check for any tenderness or masses. Do you have any tenderness when I do this?
No.
Okay, I'm just going to feel a little bit deeper. Tell me if you have any pain or tenderness.
No.
Okay. And while you're laying here, I'd like to have you take a deep breath, and when you let out, I'm going to see if I can feel the edge of your liver. And I am able to just barely detect the edge of it there. So that's good. Okay, Kelly, I'd like to have you just turn back around to the other side of the couch. This time I'm going to check to see if I can palpate your spleen, which we actually don't want to feel it, but that's why we're checking. So go ahead and take a deep breath. And I don't feel the spleen there, so that's good. So while you're laying down, I just want to do a Holman sign check to make sure that everything's good with your circulation in your legs. I'm going to press on your foot like this and tell me if you feel any pain.
No.
And then when I release your foot, I'm watching for clonus, and I don't know that either. And I would do this on both legs. We've already inspected for color, but I want to just check for edema real quick. I don't notice any edema in either leg, so that looks great. So at this point, I think I'll just have you sit back up. I am going to go back and just add one part to the neuro exam, something I forgot earlier. I want to do a test that's called graphesthesia. So I'm going to have you hold out the palm of your hand, and I'm going to draw a letter, and you tell me if you know what I'm drawing. Go ahead and close your eyes. Okay, good. And go ahead and close your eyes one more time. I'm going to place an object in your hand and let me know if you can tell what that is, just by feeling it.
A paper clip.
Very good. Thank you very much. Okay, now that you're up, I'm just going to take a minute to check your pulses. I've already felt your carotid pulse earlier, so the next pulse that we would feel for is a brachial, which I am able to detect. And then we would move down and check your radial pulse. Great. It feels strong. The next pulse that we would check for is a popliteal pulse. but that's usually unable to be detected through palpation. You have to have Doppler. And then the next pulse I'd feel for is pedal. Good. And then your posterior tibial pulse. Good. And then I'm going to check your deep tendon reflexes. So I'd like to just take your arm, and I want you to just hang your arm here and give me all of your weight. The first one I'm going to check is your tricep. Thank you, very good. And then bring your arm forward and just relax it. And this one is your bicep.